Fellow parents, Nigerians, I just wanted to use this opportunity to reach out to a different audience. As you know, we now have 2 cases in Kwara State, both of them returnees from the United Kingdom, and but they are asymptomatic. They are now in our isolation center, and they're very stable, and we're taking good care of them. We're doing everything we can to make sure we minimize or we prevent community spread. So some of the measures we're putting in place, such as locking down of by 6 p.m. today, is a way to prevent community spread. I'm here to answer any questions or concerns that you may have. The government of Abdulrazak is very committed and focused on safeguarding the well-being and health of Kwarans. We're doing everything. We have an excellent team, and everybody is working 24/7 to make sure that COVID-19 not cause havoc. So I'm here. If you have any questions, any comments, please ask.
We'll just need to observe it. When the person comes up, sir, we'll let you know, sir.
Okay. Am I still live?
Yes, sir.
Yes.
Thank you.
Or maybe you should, instead of just
Continue your presentation.
debrief maybe what the government is
So,
going to offer today.
So we're still waiting for your. But in the meantime, while we're waiting, I'll just tell you some things we've done. As some of you may know, Kwara was way ahead of a lot of states in our preparedness for any type of outbreak. Our isolation center way ahead of a lot of states. Actually, His Excellency Malam Abdulrahman approved the construction and urgent completion of the isolation center. So when COVID-19 actually happened, we already have an isolation center. To that, we're building a 1,000 bed capacity by converting one of our hospitals to a COVID-19 hospital, the Sobi specialist, which gave 100 bed. Camp is being renovated now to create a 600 bed. And the reason for that is we want to be able to cannot self-isolate to our under the care of the healthcare personnel in the state. We went straight into action way before a lot of people were thinking about it by closing our schools. We put measures into place to minimize social gathering with regards to religious and non-religious social gathering. We went right into action with public jingles, radio interviews and TVs, pamphlets and posters. We actually stopped the movement of Okadas and Marwas in the state as well. The only vehicles that were commercial vehicles carrying essential personnel and goods, and especially. So there's a lot going on. The compliance has been good, but you know, the longer these things take, everybody's working extremely hard. We know this is not an easy thing to do, but everybody's working extremely hard to our people and welfare is being taken care of. One of the things we're doing is food products we've distributed thousands of bags of rice, gari, sugar, semovida, salt. So a lot of, and actually vegetable oil to those the poorest of the poor, and people that we feel like. But I think I just saw a question that came in that says, "How are you dealing with the mental state of the patients in isolation?" This is actually a great question. This right now, there's a lot of for. This was not something we could have, or this was not something we envisaged even just a month ago. So we have our healthcare personnel that have been trained not only in infection prevention but also in providing good holistic patient care. Work with them and also to try and deploy mental health specialists to help with those victims, both victims of COVID-19. Not just them, but also our healthcare providers as well. So the second question is, does the isolation center have ICU capacity? The strategy we've deployed in Kwara State is to make sure that all levels of care are taken care of, which is the majority of people are people that need to self-isolate, but they can't do it given the condition. We bring them in and actually isolate them in our isolation center. And then the second group of people are people that just need to be quarantined. They're not positive. Then we have a second level of care, which are people that may actually be positive. They're not symptomatic. But they also need to be watched closely, but they can't do that at home. And the third level is people that need oxygen care. And the last one is intensive care. So the isolation center has 10, it can be expanded to 15-bed intensive care facility, where we have oxygen concentrators, we have suctions, and we are in the process of installing 2 ventilators to be able to take care of those patients. We have things like infusion pump and other things. So let me see what other message.
About extension of
Yeah,
that was
the first question.
So, somebody asked him, we heard there will be extension of the shutdown for 2 weeks again. How true is that?
So these things are the question was that maybe there'll be an extension of the shutdown. Dynamic process that we're all adapting to. It's not something that anybody can predict. I think what's important is to follow the trend of the curve. If you see a flattening of the curve, then we know we're out of the woods. We're out of the woods, and the only way to prevent these things from getting out of hand is to keep people at home. Then you can prevent community spread, and that becomes an issue. So I think we will make decisions on what to do with the shutdown, but no final decision has been made yet. Questions?
mental states of the
You mentioned that. He has addressed that.
Okay, there's none right now.
I'm a psychiatrist.
Okay.
I'm a
Thank you.
psychiatrist. I'm ready to bring as many psychiatrists for help. Somebody said he's a psychiatrist. He's ready to bring in as many psychiatrists as possible.
That if you
Just
need a
thank you.
psychiatrist to help,
Why am I not seeing any questions?
that's Baba Isa. Scroll up.
Yeah. Okay. 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 Well, I can help. We're always looking for partnership, for ways to be able to provide the care that our people need. So volunteerism is something that we would love to see in Nigerians, and this is an opportunity to do that. So please get in touch with us, and we'll see how we can work together. They're saying video quality is bad.
I'm going to improve on that.
Is it not bad? People always complain anyway. It's not bad.
So somebody is asking me a question, not for me. Whether he's coming to bring patient voluntary staff.
Are you willing to bring your personnel as volunteers?
That's a question to Abaiza. Yeah, I think you can just say we'll keep updating them. Because
I'm seeing there are questions still coming. Yeah, so I think, let me just conclude on this so that everybody understands the rationale that everybody we're deploying around the world, not just in Nigeria. The danger with this COVID-19 is that it can spread like wildfire. And if you know what wildfire is, if you don't contain it quickly, it can get out of hand. So if one person is infected, it can infect 3 people, then 9 people, and then within 1,500 people infected. That's not something that our healthcare system has capacity to handle. So is to actually contain the spread or community transmission of this disease. So we are working extremely hard. The welfare and the well-being and healthcare of Kwara is and very he has assembled an excellent team to make sure that we're doing all we can to keep Kwara safe. We'll keep updating you guys. This was